Hello everyone, I am Dr. K. Vamshi Krishna, consultant neurosurgeon, Care Hospitals. So basically today we will be discussing about back pain, what are its causes and what do you expect when you meet a neurosurgeon with a back pain. So the possible causes for back pain are many, a number of factors would cause for a back pain. It could be a simple muscle trauma, it could be a simple disc problem, it could be any root irritation, or it could be a simple bone which is causing the back pain. So when you present to a neurosurgeon with the back pain radiating to the both lower limbs, that is when the back pain comes into your legs with pins and needle sensation. Those are called as paresthesias. When do you present with these symptoms to a neurosurgeon? After clinical examination, he would advise you an MRI lumbar spine would you advise. Then the most common worrisome factor is why do you get an MRI lumbar spine and what do you expect in an MRI lumbar spine? Most of the patients when they come to us with an MRI lumbar spine, they would be worried with why is MRI lumbar spine prescribed and what is this L4, L5 disc bulge. So does L4, L5 disc bulge, does it mean I have to go for a surgery? No. So we will discuss about what are the factors or what are the things you have to look in a case of an MRI lumbar spine is prescribed. So when you get an MRI lumbar spine to your neurosurgeon, he would explain you why it is important to get an MRI instead of an X-ray. Where an X-ray or CT would give you only about the bony anatomy, whether the space is reduced, are there any fractures, are there any forward movement of the bone, that is called as listhesis. So the bony anatomy is completely different when you see an MRI. MRI will give you a better impression of the tissues, it gives an impression of the disc, how bad is the disc bulge, whether it is irritating the nerve root or not, everything can be clearly seen in the MRI. So imagine this is a spine, okay, your spine, you see this is the back side of the spine and this is the front side of the spine. So for each spine there would be different levels, cervical, dorsal and lumbar. For example, in the most common what we see is the L4, L5 level. See, imagine this is the L4, L5 level. At each level there would be a nerve root which goes into each leg. This would go to the right side leg and this goes into the left side leg. So what happens is when there is a disc bulge, so in between the bone and the bone there would be a disc. When this disc bulge comes out and irritate this nerve root, you see this red color over here, this is a disc bulge which is irritating the nerve root. So if the disc bulge irritates on the right side of your leg, then the right leg will be completely numb and you will have a pain in the right leg. When it is on the left side, then you will have pain on the left side. So that's how an MRI, it will give clear instructions about, it will be clear about the disc bulge, whether the nerve root is irritated or not. And also here in the image, you can see in this image, the X-ray at the L5S1, it doesn't show any major differences, only the disc space is reduced. Whereas in the MRI, you can see a huge disc bulge which is compressing the nerve root. So that is the difference between an X-ray and MRI. That means that is the amount of the information you get when you compare to an X-ray and MRI. Hope this clears your doubts about an MRI. Thank you.